Thank you for joining the Candida Workshop, looking at Candida from a different approach. My name is Heather Schofield, and I'm a homeopath and the Education Director and Medical Advisor with Biomed and Terra Medica. I'm really pleased to be able to offer information about Candida and looking at it from the biological medicine approach, which often is a very different approach than what we are taught and what we learn about. Tonight, I hope that I'm able to give you information that will broaden your perspective of Candida and also to understand the morphology and the life cycle of Candida, which is one of the aspects of creating success when addressing and treating this type of condition. We will be also talking about the CandidaFix kit later on within the presentation. Okay, so let's get started. So the first thing is, let's talk about Candida's role within the body. So Candida is a yeast form of fungus that's naturally occurring as part of the normal flora and fauna within the mouth, the gastrointestinal tract, the vaginal mucosa, and also the skin. In its yeast budding form, this is this physiological symbiotic form within the body and is part of the natural, even though it's a very small percentage, part of the natural flora and fauna. It plays a role within the body, and some of the things that it does is it helps to aid in digestion and nutrient absorption, also helps bind heavy metals, including mercury, and it helps in aiding decomposition of the body after death. I have a photo here of a nurse log, and this is a log supporting growth of other things due to its nutrient composition, and Candida in some ways can be kind of thought of that in that perspective. Now, when Candida starts to overgrow, Candida and fungal overgrowth, how does this actually occur? It's not just about a species, Candida, and all of a sudden it starts going into a more pathogenic stage. It's more about the environment. And so this is about, from a biological medicine perspective, of what's happening with the Candida. So Candida and fungal populations, the normal symbiotic ones within the body, they're naturally kept under control through the healthy intestinal flora and a strong immune system. It's when these things start to get altered that the Candida populations can start to overgrow. And so when the microflora is altered, the immune system is weakened, the pH balance is changed, then overgrowth can start to occur. And types of things that can create overgrowth are very typical things in a North American lifestyle, including diet with a lot of refined carbohydrates and sugars, also diets that tend to be acidic. So carbohydrates and sugars, when you're eating a lot of them, are acidifying, also as coffee and tea and eating a lot of red meat. And so this is one of the aspects. Alcohol consumption, again, because it can be acidifying, high stress lifestyle, antibiotic and antifungal use, oral contraception, contraceptives, and also steroid medication use. All of these things can be, again, changing environments and different types of things. Immune system issues, decreased immune defense, and finally, an increased heavy metal load. I just wanted to mention a little bit more about the connection between Candida and heavy metals. So working off of two different medical doctors, Dr. Dietrich Klinghardt and also Dr. Thomas Rau. So Dr. Klinghardt, he's a world-renowned mercury expert, and so he was linking Candida overgrowth is one of the ways that your body is trying to keep mercury and other heavy metals from damaging the body tissues. The Candida is able to engulf and hold on to these types of metals, including mercury, and it serves this purpose of absorbing them and sequestering the heavy metals. So if your heavy metals or mercury is high, then you may be getting this proliferation of Candida yeast to protect the body. Dr. Thomas Rau at the Paracelsus Clinic in Switzerland also finds that the Candida valencies, so high upregulated pathogenic forms, they occur when the milieu is severely blocked, and also heavy metal burden. And so severely blocked means that regulation is not able to happen naturally within the body. The Candida symptoms can be similar to the symptoms of mercury, intoxication calcification, which is high levels of mercury. Also, chronic dental foci and amalgams are associated with Candida, and root canal extractions have found Candida cultures at the pulp and roots when they've been extracted. Candida does have the ability to bind the heavy metals in the mouth and the gut, and stool analysis has shown positive results or correlations between Candida and amalgams within the body. Also, they've noticed that diverticuli are also hotbeds for Candida and heavy metals. So, and then one more thing to mention about all of this. When patients are going through Candida detoxes, one of the things that can happen is as the Candida die off, they release the metals, again, mercury specifically. And so sometimes there's some reactions due to heavy metals happening with release within the body. So it is, while we're not going to be talking specifically about heavy metal detox tonight, it is important to consider something along that, something as a binder for mercury, and to be thinking about perhaps doing heavy metal detoxification or binding of heavy metals at the same time with a Candida cleanse. We do have a product at Biomed called Biorella, and it's a blue-green algae chlorella that does bind onto mercury and other heavy metals and takes it out through the gut. So this could be something that could easily be taken during a Candida cleanse. Okay, so let's continue on. And another point also to talk about Candida overgrowth in relation to antifungal use. And so this can be through prescription medication, but it also can be through the herbal or other natural antifungals. So it's something that's important to keep into consideration. From a biological medicine perspective, these types of things can create these cell wall deficient forms, and it can drive the Candida deeper into the tissues, leading to symptoms and more systemic issues. There is a remedy called Pleo, which is a hapten which binds on and marks for the immune system to rid the cell wall deficient forms that could be due to Candida. And so we'll talk about that remedy a little bit later on. And then finally, just to talk a little bit about morphology with Candida, just so we have a better understanding of what we're actually dealing with, or why is Candida so hard to resolve. And so we'll talk about the morphologies right now. So there's a number of different stages. The budding yeast stage is the physiological stage. And when it's in these physiological stages, this is when it aids in digestion and nutrient absorption. And it also is what's occurring naturally within the healthy symbiotic flora and fauna makeup of the gut and other tissues in the body. But what happens and where things start to become a problem is when you start to get these hyphae. And these hyphae are these projections that start to come, and I think of them kind of like roots. These are the things that get into the tissues. And so in the hyphae or pseudohyphae stage, these changes are triggered by pH changes in the body, and the pH changes tend to be acidic, intestinal tract becoming more acidic, and also changes in the microflora, so decreased microflora. So for example, let's say somebody's having a diet really high in refined carbohydrates, and they ended up taking some antibiotics for a sinus infection. The antibiotics start to wipe out the flora and the fauna in the gut, and the acidity is creating a really nice environment for the Candida to start upregulating into a more pathogenic form, and you start to get this type of formation of the pseudohyphae. If the environment continues to be good for the hyphae or the mycelial form or this fungal pathogenic form, then this is when it really starts to get deeply within the tissues. I'm going to read you a few things from two different articles, and then I'm also going to attach these in a follow-up email so that you have these articles. I really love both of them because they talk in a very in-depth way about the morphology and really give a deep understanding of what's happening with Candida. The first thing, and this is an article by Dr. George Giorgio, and he's a naturopath, and he talks about, in his article, it appears that this change in pH can trigger genes in the Candida yeast to begin a pleomorphic change into a stealth organism that is very active. If fed with sugar, it can increase itself from 1 to 100 cells in 24 hours. These 100 cells can then produce hundreds each in the next 24 hours, and so on. So by the 4th day, we will have 100 million Candida cells. And so this is how quickly things can change within the body and how quickly the yeast can go into major overgrowth within the body. It does take days. It doesn't take weeks. It doesn't take years. Mind you, it can take that long to initially get into a systemic chronic issue, but it only can take a very short time for things to really ramp up with the pathogenic or parasitic Candida. And then the second article that I just wanted to read a few points out of is an article by Joaquin Hartman, and the article is called Candida albicans and Our Body's Endogenic Defenses. So he's talking about some Pleo Sanum remedies, and so this is going to be one of the remedies we talk about tonight, Pleo alb, or also known as albicans. And this specific remedy is successful. It's a successful biological therapy for this widespread mycosis in diverse appearance forms. So the beauty with Pleo alb is it helps to kind of hit all different types of morphologies to downregulate back into the physiological budding yeast form for Candida. And this is the part, that's really important, and one of the reasons why using a Pleo Sanum remedy, specifically Pleo alb, is going to allow you to have much better success, short-term and also long-term success with helping treat Candida with your patients. Okay, so just to understand Candida a little bit more, again from this article, there's 3 main constituents of the Candida albicans cell wall, and this includes these polysaccharide glycans, a chitin structure, and then also a third polymer mannan. The glycoprotein, which is the polysaccharide glycan, it has important functional properties that manifest in Candida, and what this property is it allows the Candida albicans to adhere to the host cells. So this is not good for the body, the human body. Also, the fibrin layer has been discovered to have adherence factors also from Candida to the host cells. And when the Candida starts to adhere to the epithelial cells within the body, things become much stronger in the fungal phase than in the yeast phase. So the fungal phase, which is the mycelia or the hyphae phases, this is when things become much tougher to address and to treat because the Candida kind of really gets in there. Now, as I mentioned at the beginning, a well-functioning immune defense is able to damage the yeast form and the mycelial form of Candida albicans through phagocytosis. However, once the Candida has settled in, then the macrophages has less effectiveness. And this is due to a number of things. So the Candida hyphae, they have these large aggregates that cannot easily be phagocytized, and also the recognition of the Candida cells by the macrophages and the granulocytes becomes blocked. So Candida, even though we can't necessarily think of it as an intellectual species, it sure as heck has a really strong survival instinct. And so it starts to change, and so the body's immune cells no longer are able to recognize it and to basically eat it up. So the next thing that Candida cells also can do is they can escape attack by the immune system through mimicry, and so the hyphae, they excrete substances that stick onto the granulocyte surface and then block the binding, so then it can continue to survive. And then also from a humoral immunity perspective, Candida albicans can also escape defense mechanisms through a yeast mycelial dimorphism. And so not only the outer wall layers, but also the deeper layers are chemically rebuilt or expelled from the Candida. Therefore, antibodies directed against the yeast forms can no longer recognize the pathogen. And so they're able to survive again. And then finally, there's an adaptive mechanism of Candida to immune defenses of the host cells. They're very subtle and very extensive. They have characteristics which evade nearly all defense attempts directed on all levels. A nearly intelligent binding and counterbinding concept on the level of Candida receptors is what makes these Candida albicans virulent species so virulent. So you can hear just from this brief points that I've pulled out of this article that Candida has a mechanism to survive. And I'm going to talk about some diets in a moment, but this explains why kind of the diet starve approach and the kill Candida approach may not be a long-term success strategy, and why when we understand about morphology and Candida, this is really the way to long-term have good success. Okay, now we have some poll questions, and so these are going to pop up onto your screen. And if you could take a moment to answer the poll questions. Okay, so let's go through the poll questions and answers for everything. Okay, so the first question, what role does symbiotic Candida play within the body? The answer is all of the above. It aids in digestion and nutrient absorption. It binds heavy metals, and it also aids in decomposition of the body after death. Number 2, what are the different morphologies of Candida albicans? The budding yeast, the pseudohyphae, and the hyphae phases. And then number 3, Candida can become a cell wall deficient form, and the answer is true, yes it can. And this is through taking antimicrobials or antifungal type medication. Okay, so then let's continue on. So the Candida Constitution, this is a tendency towards fungal or mycotic type conditions and dysbiosis within the gut. Typical conditions are seeing these local or systemic fungal infections, especially of the skin and the mucous membranes, things like digestive issues, candidiasis, gas, and bloating. We'll go through a much bigger list shortly. Candida, oh, so here we go, here's the bigger list. Candida overgrowth symptoms. So these are a whole variety of different symptoms that you could see in patients with Candida. And it includes things like gas and bloating, intestinal disturbances, diarrhea, constipation, IBS in some cases, leaky gut, sugar cravings, and fruit intolerance. The sugar cravings often are the Candida craving the sugar, and it creates these unquenchable sugar cravings. The fruit intolerance is because of the sugar, and sometimes it just allows the Candida to proliferate. Allergies or itchy ears, autonomic nervous system disturbances, autoimmune conditions or disorders, chronic yeast infections, urinary tract infections, itching, bladder infections, fatigue, brain fog. Those are 2 things that can be associated with Candida overgrowth, especially if it's gone systemic, and part of where those symptoms, those types of symptoms come from, the fatigue, the brain fog, the depression, the fibromyalgia, the chronic fatigue, they come from the mycotoxins that are released from the Candida. And specifically acetaldehyde is one of the things that Candida can release, and this creates these types of sensations within the body. Also, other types of symptoms include nail fungus, toenail or fingernail, skin issues, athlete's foot, and jock itch. However, there's more for sure to this list. This list is not exhaustive. Okay, and then here's a few images here. So we kind of talked through some of this. So fatigue, itching, burning eyes, mouth ulcers, dry itchy skin or rashes, genital itching, bloating, white coated tongue, and you can see in the image here that this would be what you may see. I always ask all my patients to stick their tongue out so I can take a look and see if there is this type of coating on their tongue. And then also constipation and diarrhea, which we already mentioned. And then from a nail fungus or nail perspective, you can see here on the left, this is what a healthy nail looks like. And then this is a progression. So there's this yellow discoloring of the nail. It may not be the full nail initially, but partially part of the nail. As the severity increases, and you can see there's a yellow, brittle crumbling of the nail. Mostly the entire nail is affected, and the nail doesn't have the strength, and so basically it breaks. We will talk about, we're going to be talking overall protocols with Candida, but I'm also going to talk about some specific nail fungus protocols as well towards the end of the presentation. The other thing to talk about, and this is something that's not talked about so much, but is a very valid component, is the emotional meaning of Candida. If you understand about the deeper emotional stuff, sometimes this is one of the places that you can work at. As you know, through Biomed, we have a line called Rebalance for the psychosomatic energetics, and it's a really beautiful system of medicine to address the deeper underlying emotional issues and stresses and traumas that can be affecting the overall body and symptoms. So for Candida, from an emotional perspective, types of emotions would include feelings of being scattered, lots of frustration and anger, demanding and untrusting in relationships, emotional distress around relationships, specifically around relationship with mother, great takers, struggle to find and sustain balance in life. And so two of the remedies that could help address these types of things would be the chakra 2 remedy, which is called Shavita number 2, or chakra 4, which is Shavita number 4. And so chakra 2 is dealing with stress, and chakra 4 is dealing with strengthening the immune system. And then just from a testing perspective, there is a variety of different ways and different types of tests that you can use to understand about Candida. And so these types of things, patient history and symptoms is a really great way to really kind of figure out Candida-wise, Candida overgrowth, and also the Candida questionnaire. There's lots of different ones available. One that Dr. George Giorgio recommends is Dr. Crook's Candida questionnaire, and you can just Google that and get that online. Other types of testing, blood tests, looking for Candida antibodies, stool testing, and this is a really great way to see what's going on in the gut. Candida levels in the lower intestines and colon, you would want to use a comprehensive stool analysis, and you can do this through Doctors Data, which is in the U.S., and they have a really great comprehensive stool analysis package. And this also helps to determine the species and which treatments will be most effective. They're looking at herbal type things like oregano or caprylic acid. You can use the urine organics dysbiosis tests, and so it's looking for waste products of Candida overgrowth in the urine. And then finally, a spit test. And so with the spit test, you can spit into a glass of water first thing in the morning, and then check every 15 minutes for an hour. And you're looking for different types of things, like if the saliva grows legs, becomes cloudy, there's floating specks. These types of things can indicate Candida. If the saliva remains floating and clear, then there's no indication of Candida overgrowth. Okay, so then let's continue on here. Okay, so we've got some more poll questions coming up now. Okay, so 3 questions, and we'll give everybody a minute or so who wants to answer them to go through and answer them. Okay, so let's review the answers for these poll questions. Okay, so the first question is, the Candida constitutional type includes the following: A, tendency towards fungal and mycotic conditions and dysbiosis. B, local and systemic fungal infections, especially of the skin and mucous membranes. C, white spots on the nails. And D, digestive issues, including gas and bloating. So the answer is A, B, and D. It does not include white spots on the nails. That is not at least it's not a direct thing. Usually white spots on the nails, one of the big indicators is a zinc deficiency, often due to poor absorption or inflammatory processes in the gut, and so not what you would classify as a typical Candida symptom. Number 2, which is not a typical symptom of Candida overgrowth? A, gas and bloating. B, sugar cravings and fruit intolerance. C, autoimmune conditions. D, bladder infections. E, heart palpitations. Or F, brain fog. Heart palpitations is not a typical symptom of Candida overgrowth. And then finally, the third question, what would you expect to see on the tongue as a sign of Candida overgrowth? Green slimy film, yellowish or whitish patch on the back of the tongue, which is the answer. Okay, so then let's move on then to the next portion of the workshop. So this is now the portion of starting to talk about what do we do about Candida and Candida overgrowth. We've talked about the morphology, we've talked about symptoms, and we've looked at what some typical symptoms are. So now let's start talking about what we can actually do. And this is, again, all coming from a biological medicine perspective, and it's about treating the gut, it's about treating the terrain and the milieu, it's about pH balance, it's about the flora and the fauna and trying to support them in a very positive environment. It's about down-regulating Candida, and so therefore we get the Candida back into that yeast bud physiological form. And so it's kind of this whole perspective, and it's not that difficult to actually accomplish these things. It's just tweaking and doing a few very specific things and having a patient that's really willing to work outside of the box of the norm. Okay, so biological approach, healthy gut, healthy body. That's, I guess, the bigger picture. A healthy gut and balanced intestinal flora leads to proper digestion and a strong immune system. This is the utmost importance for health in general, eliminating Candida and fungal overgrowth and recovery of chronic disease and illness. So it's a strong immune system and a really well-balanced gut is going to help keep Candida in check. Let's just quickly review the constituents of the gut. So the mucous membranes, that represents the major defense system in the body and also a protective barrier. When you have a leaky gut, then this can allow Candida to get deeper within to this system or within to the body. And there are ways that Candida actually does secrete different things to break down the mucous membranes within the gut. And so therefore that can create a very big problem. So this is why keeping the mucous membranes healthy is very important. The Peyer's patches represents 80% of the adult immune system, and that resides in the small intestine. So again, this is about the immune support. And then finally, the bacterial lining offers resistance to growth of bad bacteria and fungi, including systemic yeast and Candida. So the microflora is also really important. We're not going to talk so much about a diet tonight, but I do want to talk about eating for restoration and regeneration. This is not about a kill Candida diet. Instead, it's about supporting the gut, supporting the flora and the fauna, and it is also about reducing some things that can help proliferate Candida overgrowth. So we're looking at removing potential allergens and acidifying foods from what we and our patients are eating on a daily basis, and this is going to allow for a healing of the intestinal system, the mucus lining, support bacterial flora, and also support the Peyer's patches. Oh, and by the way, Pleo Reb or Pleo Rebasan, it is a Peyer's patch extract that is available from Sanum. Okay, so the basics for restoration and regeneration from a diet perspective, you're going to be able to build up intestinal flora, eliminate cow dairy, gluten, and other food sensitivities, so that's a big component that's important. reduce protein intake to more ideal levels of 60 grams a day, because that's what the body can actually process within the day. Increase raw fruits and vegetables, specifically raw vegetables, because we want to increase the cellulose levels, and I'll explain that in a minute. Also to support liver function, bile flow in the bowels, and then finally acid-base balance to support the milieu. So a few notes here. This diet tends to be low in protein, 40 to 60 grams a day, because this is the amount that is processed on a cellular level. More than that, the body creates excessive acidity. If the body is well functioning and well regulated, then the body can excrete the additional acidity. However, lots of bodies are not well regulated, and so then it just creates more acid in the system. With the protein, it's recommended, at least during restoration and regeneration, to use mainly plant-sourced protein. The diet, it's alkaline in nature because we're eating lots more vegetables and fruit, and so a healthy body is always sustaining balance in a slightly alkaline way. However, each pH of the different tissues in the body has different levels, so eating a slightly alkaline diet or an alkaline diet is going to help the whole body regulate what the ideal pH is within the different tissues. Raw foods, especially vegetables, are really important because they're high in cellulose, and this helps support the healthy and beneficial flora. It helps to prevent the candida converting into pathological or pathogenic forms. The diet should include foods that are free from allergens, particularly cow dairy products. They can cause congestion, inflammation, and impairment of the immune system, also disrupts regulation. And one of the things that has been connected is high levels of lactose, sugars, and increased candida pathogenicity. So dairy in this case is not a good idea, or at least to eliminate it till the restoration and regeneration of the body has occurred. And then two more things, high in omega-3 fatty acids. This enhances the cellular metabolism, cellular membranes, transmission of neurosignals, oxygenation of the tissues, healthy flora, will manufacture omega-3 and omega-6 in the gut. And finally, specifically to Candida, digestive enzymes and coconut oil are also important. The digestive enzymes help to break down the Candida, and the coconut oil does contain natural caprylic acid, and caprylic acid, if you want to visualize it, kind of pokes holes into the Candida walls, and it allows the immune system to have better access. Okay, so I want to just make one comment about the starve diet, and this is from, again, a biological medicine perspective, and also from Dr. Rao at the Paracelsus Clinic. This is also information that he shares as well. Candida is regarded as a sugar consumer, and this is sometimes why we crave sugar if the Candida levels are high. And so when we're trying to starve out Candida or fungal microorganisms, we can push them into the upward development. And so the upregulated form from a pleomorphic form is pushing it into the more pathological form or into those hyphae mycelial type formations. And then if you remember, those hyphae or mycelial kind of look like roots or kind of these projections that are growing, and it drives it deeper into the tissues to feed off the glucose from blood vessels. So this is how Candida becomes or can become systemic. Candida does not like to be under attack. As we discussed earlier from the one article by Dr. Hartman, Candida has very clever ways of evading the immune system. So when Candida feels like it's under attack, it's going to go into hiding or deeper within the body. And then because it's a sugar consumer, it's going to go to find the sugar. So if you don't have sugar in the gut for it to feed off of, then it's going to go deeper within the body. Now, when we're talking about a diet, it's not a diet that should be high in refined carbohydrates. It should not be high in sugar. It should not be high in huge amounts of fruit. However, it's not talking about 100% avoidance either. It's talking about in low levels, and some fruit is okay, especially when there is a lot of fiber and cellulose. Those are the most ideal. So it helps to feed the Candida, but also diet high in cellulose helps to feed the beneficial flora. And that's one of our aims when we're working with Candida, is to support the flora and the fauna in the gut. It helps to keep the Candida within the intestines. And so again, this is talking about raw foods like apples, for example, and then lots of other vegetables. And then by keeping the Candida in the gut, when we're taking remedies to downregulate the Candida, it will actually be present there so that it can just be excreted out. It helps accelerate the passage through the gut to be eliminated. And finally, cellulose also does help assist in the elimination of heavy metals. So pillars to eliminate Candida overgrowth. So we talked about the gut and the diet, and then the next thing is reduce, replenish, rebalance. And that is reducing Candida overgrowth, it's replenishing intestinal flora, and balancing pH levels. So those principles are not too difficult. And so we've created a kit called the CandidaFix kit, and this kit is designed to reduce, replenish, and rebalance. So 3 simple remedies to be able to do all of these things. We talked a lot about the fact that you need to support the flora and the fauna and a strong immune system, and so this is also designed to do that. By adjusting pH balance in the body, that helps support the immune system. By supporting the gut, that again, because of the Peyer's patches, helps to support the immune system. So the approach here is looking at downregulating Candida using Pleo alb, which is a Sanum remedy, using Probiotic 7-in-1 to replenish the healthy flora, and the Basictabs to rebalance normal acid-base levels. If you also want to be looking at doing some emotional work with your patients, then you can also do some Rubamid testing to see what Shividas and Mbita remedies would be used as pairs to reduce the emotional or the unresolved emotional issues that could be in relation to the Candida. Okay, so I'm just going to go quickly through some of the remedies here. So Pleo alb, it contains Candida albicans, and so Candida albicans, or Candida albicans has 81 different species under the Candida albicans umbrella. So this Pleo alb, or the Candida albicans remedy, really can address a lot of different species under that umbrella. It's used to downregulate the pathogenic Candida into the physiological or symbiotic form, into the bud yeasting form. And so therefore, it's also going to be helping with all of the types of chronic and systemic Candida-like symptoms. And just as a side note again, high levels of Candida may be associated with high levels of mercury or heavy metals, so maybe consider also doing some binding of mercury when you're dosing with this. There's a variety of forms that Candida albicans, or this Pleo alb, comes in. Within the CandidaFix kit, it comes in drops, and so the dosing is 5 to 10 drops daily, and it's actually 5 drops orally once a day. There are suppositories available as well, and so for patients that are having chronic reoccurring vaginal yeast infections, then the suppository may also be something to include into the protocol in addition to the CandidaFix kit. Also, Pleo alb, it comes in an ointment, and so this is a really great topical remedy, especially if there's any skin symptoms and nail fungus. So skin, nail, and topically vaginal as well is going to be great to help reduce those symptoms, and then to downregulate. And also in the vaginal yeast infections, if for some patients they feel like something's coming on, sometimes Pleo alb, using it prophylactically, can also help prevent an infection as well. Okay, so that's Pleo alb, and then next let's just talk about Probiotic 7-in-1. So in the name, there's 7 different species, includes the Lactobacillus species, Biobifidum, and also a Streptococcus species. And the recommended dosing is to be taking 1 cap twice a day. to help to replenish the flora and the fauna in the gut. Okay, and then finally, rebalancing the pH with Basictab. So this is an acid-base remedy, and it's working to achieve pH balance within the gut, or sorry, within the whole body. And the tablet form, so we also have basic powder, and we have another remedy called Alcala, which you may be familiar with. And so we put the Basictab into the CandidaFix kit because this is just a really easy form to take it in. The tablet dissolves within 1 minute, and it increases compliance in many patients. It includes calcium, magnesium, potassium, and sodium. And so the potassium bicarbonate and sodium bicarbonate are the two key components whenever you're working with acid-base balance in the body to not only flush out the excess hydrogen ions, which is creating the acidity, but also supplying the raw material for better digestion, so better hydrochloric acid production, better pancreatic enzyme production, and better bile salt production as well. So dosing is 2 to 4 tablets. In the case of the CandidaFix kit, it's recommended 3 tablets twice a day, and it's really important to remember warm water on an empty stomach. Warm water on an empty stomach. You need the warm water and the empty stomach so that it doesn't interfere with digestion. The warm water also is going to allow for this to move through the stomach and the pyloric sphincter into the small intestine, where it can actually start to do the work that it needs to do. Okay, and so I just wanted to mention 2 other Candida remedies. So in the CandidaFix kit includes the Pleo alb, the Probiotic 7-in-1, and also the Basictab. There are some instances where you would consider 2 other Candida remedies. So they would be things that would be done on top of the CandidaFix kit. And the first one's called Pleo Pef. Pleo Pef is generally used more in children or in the younger ages, and for things like thrush and cradle cap, and kind of first when Candida is starting to be seen in the body, and it's called oral mycosis. So you're starting to see it in the mouth, or maybe first vaginal type infection. So Pleo Pef can be used very successfully there. In some protocols, it's also recommended after alb has been used, then you would add in 1 bottle of Pleo Pef at the end just to do any further down regulation. And it's also a Candida species as well. And then there's also Pleo San Cand, and Pleo San Cand is the cell wall deficient remedy for the cell wall deficient forms. And so Pleo San Cand would be used in patients that have had long existing systemic Candida, never well since, can't seem even after doing Candida type cleanses and diets, never really seems to be able to fully get better. And so Pleo San Cand then, especially to deal with mycotoxins that are released by Candida and or due to cell wall deficient form, perhaps due to previous antimycotic and antifungal remedies that turned it into a cell wall deficient form, it's going to be able to tag this for the immune system to be able to clear out as well. Okay, so those are a few extras. And then finally, we've got one last quick poll here with 3 more questions. So take a minute to go through and answer, and then we'll go through the answers for you. Okay, let's go through the answers here. Okay, which statement is true about Candida? A diet in refined carbohydrates does not lead to Candida overgrowth. No, that's false. A spit test can indicate Candida overgrowth when you see a deep blue hue. That's also not true. Candida has no relation to increased mercury levels in the body. That's also potentially not true. So true is healthy intestinal flora and a strong immune system can keep Candida at bay. Okay? And then the next, the Pleo Sanum remedies that can be used for Candida. The answer is all of the above. So Pleo Alb, Pleo Pef, Pleo San Cand, and also Pleo Alcala can all potentially be used in a protocol. In the CandidaFix kit, we've got the Pleo Alb, and we have the Basictab. The Pleo Alcala and the Basictab basically function are the same because they're both alkalizers. And then finally, CandidaFix kit contains one of the following, contains which of the following products? Basictab, Probiotic 7-in-1, Pleo Alb, and also simple and straightforward instructions for your patients. Okay, so thank you everybody who participated in the poll questions. We just have a couple more slides here and then we'll be finished for the evening. So how to ensure long-term Candida success? So I've said this a few times now, Candida and fungal populations are naturally kept under control through healthy intestinal flora and a strong immune system. So that is the goal from a biological medicine perspective, is to support the gut, to support healthy intestinal flora, and also to have a strong immune system happening, and allowing the body really to be able to regulate on its own and do all of these things on its own. To do that, we need to make sure that there's a variety of things that are happening in the body. And so number one, supporting a healthy gut, and this can be done through diet, it can be done through probiotics, it can be done through different products to heal the gut, and then also support the immune system. And so supporting the immune system, inherently when you support and create a healthy gut, you're also going to help to support a healthy immune system and a strong immune system as well. And then also probiotics, that's another big component of an immune system, strong immune system. Repair leaky gut, things like L-glutamine, NAG or N-acetylglucosamine, those are great things to help repair the mucous membranes in the gut. Diet with lots of raw veggies because of the cellulose, again, to give food to the microflora and to keep Candida in the gut. Keep pH levels in balance, and this can be done through acid-base balance. Decrease the heavy metal load and support heavy metal detoxification. Supporting the intestinal flora. The probiotic 7-in-1 has lots of different species, so that's a really great way to get started. And then finally, to address stress and emotions that are out of balance as well, is going to help to lead to the long-term Candida success. The last thing that we haven't mentioned here, but it's also to be really truly understanding the life cycle and the morphology of Candida, and so therefore downregulating it into a physiological symbiotic form is the other way that we can actually get Candida back into its normal balance, and then using all of these other techniques will help to keep it within balance. And Pleo Alb, fortunately, it's a very unique remedy as an isopathic remedy, and this is one of the best ways to be able to do this. And when I say that, it's not just me saying it, it's me knowing that the biological practitioners across Canada and North America and all across Europe have all had really great success using Pleo Alb in this type of approach to reducing Candida overgrowth. And then finally, the CandidaFix kit. So I've talked about it a number of times. Again, it contains the remedies to have a nice biological approach to downregulate Candida. It follows the principles of reduce, replenish, rebalance, and it's a 4-week program. In many cases, patients are going to need between 1 and 2 kits, depending on the severity or the depth of systemic Candida and the length that they've had it. But this approach really is going to do a lot of great rebalancing. We also, within there, have a write-up on the CandidaFix kit and what it is and kind of all of these general principles. And so those are available with the kit, but you can also request them to have the handouts in your order as well. And finally, thank you. Okay, so before we truly end, what I also want to do is invite anybody who's got some questions to type them into the Q&A section, and I will go through and I will answer those questions. So general systemic candida or fungal overgrowth, the CandidaFix kit in most cases will be enough to downregulate and then rebalance, replenish, reduce. In more severe cases, you may need to use 2 kits, which would last instead of 4 weeks for 8 weeks. And if somebody has had a lot of antifungal or antimycotic medication, whether it be strong herbals or pharmaceuticals, you may want to consider the Pleo Sand canned remedy to add in addition to this. For women who have vaginal yeast infections, reoccurring or first time, they would want to be taking the kit because once you start to see yeast infections happening, it's a greater indication of systemic candida. And then, so in addition to the kit, for those women, I would also recommend to include one Pleo alb suppository, and this can be used vaginally or rectally, and one time before bed every 3rd day. So they would be taking the Pleo alb drops orally, 5 drops once a day, and then they would be taking one suppository every 3rd day. And the reason not to do it every day is because every day with the suppositories may be too big of a push and you may get a Herx reaction from it. Skin and nail infections and protocols. The kit would be what's recommended, and then in addition, 2 more things. Either the Pleo alb drops or the Pleo alb ointment can also be applied topically to the nail or the infected area. And so whether this is nail fungus or rashes or like groin itch or athlete's foot, so nail or skin, this is what's recommended to use the kit. So because again, when you're starting to see rashes and also nail fungus, it's a greater indication of systemic candida happening in the body. So you need to get into the gut and really get that cleared up. And then in addition, you can just work topically to reduce the symptoms in that section of the body. And so the ointment, the Pleo alb ointment or the Pleo alb drops, a few drops, can be applied to the affected area. And then the other thing that's important is to change the pH balance. And so for nails, toenails or fingernails, it's also recommended to soak in an alkaline bath. So you can just recommend for the patient to use baking soda into a bowl of warm water and then just to soak the nails. Or if it's a skin area, what they can do is they can use baking soda and they can make a paste and then just apply it topically to that area, let it sit till it dries, and then rinse it off. And that's a really good way just to be changing the pH in the environment, which is going to really throw the fungus right off completely because it prefers a more acidic environment. And then you're working deeper systemically in the body. And then finally, for those little people, thrush and cradle cap. Pleo puff drops can be used, and they are safe in infants. So often we see thrush or cradle cap in newborns, and that would be due to the fact that if it's a vaginal birth, they could be exposed to candida from the mother. And there are healthy populations that are already in the gut and the mouth of infants. And so if those start to go out of balance, Pleo puff is going to bring it right back in. So for little ones, they can have the drops orally, Pleo puff drops orally, 1 or 2 drops once or twice a day. For cradle cap, you can mix a little bit of water and a little bit of the Pleo puff drops, and you can put it directly on their head or on the cradle cap affected area, and that's going to help to just rebalance that as well. We have a number of questions here, so I want to go through these to answer them. So first, for someone who has never detoxed, do you recommend the Nesman Pharma Detox Kit prior to the Candida Detox to open up the pathways and aid in drainage? The short answer is yes. In some cases, if they've never detoxed before, but their constitution is fairly strong, you could do it in combination at the same time. For somebody, though, that you think potentially could be very much in need of liver and kidney and lymphatic drainage, then I would recommend to do it first. One of the reasons is for some people, the die-off with Candida can be intense. It's usually not very long. It tends to be a few hours, potentially to a few days. But the better the elimination pathways are working, the less to no reaction is going to actually occur. So it is a good idea to detox first for patients who have not. Okay, and so the next question. So Stephanie, I hope that answers that for you. Okay, next question. Can you clarify warm water for taking Basictab? So warm water would be lukewarm to the hottest that you can tolerate. And so that's a good question, exactly how you describe the warmth. It would be, if it makes sense, if it's really hot water, it's too hot to drink, then that's not right, but enough where you can comfortably drink it without feeling like it's too intense to drink, that would be kind of the warmth of it, so fairly warm. If you're having boiling water, then you would just let it sit for 10 minutes before you would drink it. So you would then swallow the tablet with the warm water, and the tablet will dissolve within the stomach within 1 minute. Room temperature water should be warmer than room temperature water. And the whole reason with the warm water is because with the stomach, it has to warm everything up before it's going to allow it to pass through the pyloric sphincter into the intestinal tract. And so by drinking warm water and trying to match it to the body temperature, then this is going to allow it not to sit in the stomach at all, but basically move through. So I guess actually the best explanation would be kind of body temperature. If you were to use room temperature water, the body still will then have to warm it up the rest of the way. And therefore, it may sit, the Basictab may sit in the stomach, and sometimes it can cause some burping. So for some patients, for drinking hot tap water, lots of people don't like to drink tap water, so if they can drink filtered water and warm it up, that would be the best option. I do have some patients, though, that can't go to the trouble and need it as easy as could be, so I do recommend then just hot water from the tap. If that is going to increase compliance, then that could be a recommendation. But otherwise, yes, natural filtered water is better. Okay, next question. Do you recommend colonics while on the CandidaFix kit? The answer is I don't have a lot of experience with colonics. However, with that said, if that's going to do a really good clean out of the intestinal tract, then it could be a good idea, especially if there's a really deep systemic candida, just to kind of aid in getting everything moving. It's not a bad idea to start with. I do know that at the Paracelsus Clinic in Switzerland that they definitely recommend colonics. So definitely would be something to consider. And the next question about eczema being a sign of Candida overgrowth, it can definitely be a sign of it. Lots of different types of skin rashes can be. Eczema also has other links to intestinal issues and food intolerances, and so food sensitivities. So already eczema, even though it's presenting on the skin, at least from a biological medicine perspective, it's really an indication that there's a greater intestinal disturbance and imbalance happening. And so in that case, yes, Candida can be part of it. And you may want to have those patients with the eczema do a Candida questionnaire or look to see for history and symptoms. And in that case, in addition to whatever you're working on with the gut, to consider putting some of the Candida remedies in as well. Okay, and the last question that I have here is what are the best tests to diagnose all forms of Candida, systemic, and which to downregulate the other versions? Okay, so, and also having a client with fatigue and brain fog and sugar cravings. So now I know that we gave a big list of different types of Candida symptoms, but not every single person exhibits all of those things. Fatigue, brain fog, and sugar cravings could definitely be a good indicator of Candida and systemic Candida. And so testing-wise, there's a variety of different things. I would probably have the patient do a questionnaire And I would say even just specifically from the symptoms that you're seeing right there, that would be enough to guide you towards going with a Candida protocol to downregulate. You also may want to ask to look at the tongue. And of all of the types of tests, the one that I'm the most familiar with, and I know gets good results, is a comprehensive stool analysis. And one of the reasons is because it also will indicate the different types of species of Candida that can show up. And so if you're looking to see what kind of species there are, then that would be one of the ways to do it. So for systemic and downregulating, you basically want to downregulate all of them. The Pleo alb will downregulate a huge variety under the Candida albicans umbrella. Okay, so Esther, I hope that answers your question. And then one other question here about an ileocecal valve malfunction. Can it cause Candida to migrate into the small intestine and cause infections? Candida can be found throughout the entire intestinal tract, and so it's possible that with a malfunction, it could potentially create a larger migration. However, back to kind of what to do about it, because that's the bigger question, and downregulating the Candida is the most important part, and getting the flora and the fauna rebalanced, getting your immune system nice and strong, those are different types of things that would be things to consider. An acid-base balance, so working with an alkalizer. Okay, and finally, I've got one more question here. So regarding tea tree oil, shampoo or conditioner, and so if we're talking systemic Candida, tea tree oil shampoo or conditioner, if a person does not have a Candida issue or a systemic Candida issue, then you may find that it's not going to be an issue at all and it's easy to use. However, the one thing with tea tree oil is to remember that it is potentially changing the flora and the fauna even of the local area, so on the scalp. Is it going to contribute to virulent forms of Candida? I don't know exactly if it would or if it wouldn't. However, if there's already a systemic Candida issue showing up in the body, then it's not going to further promote more potentially because it's already happening. And so it could be something that would be used short-term to help to downregulate in the area. However, I do know with really great success, if you're dealing with stuff on the scalp or anywhere in the skin, by using alkaline pack or alkaline paste from using baking soda and topically using Pleo alb, you can get some really great success and movement with that very quickly without needing to go for an kind of fungal approach. Okay, and so with that said, thank you everyone. Thank you for joining the Candida workshop tonight and understanding and learning all about a different approach to Candida. Thank you again for attending and have a really wonderful evening. Take care everyone.